take it back. Disruptarian rise, time to break the pack. Jump the cart, American fight. Murder the woke mind virus tonight. Pop, pop, we ain't scared of no lies. Disrupt the game, we gon' rise. Yeah, snuff the woke mind virus, clear the infection. Disruptarian truth, this is the correction. They pushing lies, but we stand tall. Freedom in our veins, we break through it all. Feminism backed in the age of reason. No more games, yeah, this is our season. We ain't slaves to the system.
My name is Matt Walsh. I'm here as a husband, father, and concerned citizen of the state of Tennessee, and I want to thank the committee for allowing me to speak and for all of you on the committee who support this important legislation. Now, I know that we can't agree on very much these days, but we should be able to agree that our most solemn responsibility as individuals, as a state, and as a country is to protect our children. We should be able to agree that children do not have the physical, emotional, or mental capacity to protect themselves or to make life-altering decisions. We should be able to agree that it's never okay to chemically castrate, sterilize, butcher, or mutilate a child, and in fact, all decent people do agree on all these points. But many of the people who hold power in this country and who run our institutions, including our medical institutions, do not pass this basic test of decency. They've made House Bill 1 not only necessary, but one of the most important pieces of legislation this body has ever taken into consideration. In service to a radical far-left agenda, children are being led down a path of gender confusion and identity crisis. This crisis, manufactured by the cultures and exploited and monetized by medical professionals who first put them on chemical castration drugs like Lupron. Then the victims are given cross-sex hormones, which often have irreversible and permanent effects. Finally, before the age of 18, many of these kids will undergo surgery, such as double mastectomies, which will alter their bodies and their lives forever, taking something away that they can never get back, no matter how much they regret it in the future, and so many do. This is happening across the country, and that includes in our state. Children are being coerced into decisions that they are not equipped to make in pursuit of a goal that can never be attained. The girl who gets the double mastectomy is no closer to being a boy after getting the procedure than she was before. She's still a girl and will always be a girl, just now a mutilated and damaged one. Now, you may notice that most of the people who support and advocate for this butchery are not petitioning to lower the drinking age. They're not trying to pass a law to allow middle schoolers to get tattoos or take out mortgages or purchase firearms or cigarettes. That's because even they recognize that minors lack the maturity and discernment required to make those choices. They recognize that when it comes to alcohol and tobacco and guns and mortgages and tattoos, yet when it comes to irreversible, life-altering medical interventions, suddenly these same people discover a newfound confidence in the responsible decision-making powers of children. Their position is not even consistent or coherent, much less morally or scientifically defensible. We cannot allow this wickedness to continue. We cannot tolerate it. We are decent and rational people in this state. We love our children. We recognize.
Okay, so today I'm here to talk about the whole transgender issue in law with Donald Trump banning public funds from going to transitioning young children under the age of 19. It doesn't prevent private insurance from funding that, but it does prevent public funds going to that. And I wanted to describe, first of all, a person who is detransitioned, a person who describes herself as somebody that was fixated on gender identity from the age of 12 after learning about it online. And then it became what she calls her autistic fixation. And then she detransitioned after realizing the craziness of it all when she was an adult. And it has left her permanently disfigured. And this is something I've tried to save my kids from. My kids say that they hate me because of this. And all I did was I shared this with my daughter. She is my daughter. She's not a boy. She's definitely a female. Biologically and otherwise, she is a female. And I just tried to share this protecting gender thing with her from this detransitioner who calls herself Maya Poet 99 on TikTok. And she says, and you wonder why your kids don't like you. Now, first of all, I'm a libertarian. This is a strong fact of my history for the last, 25 years. And I shared this with her as well. Democrats like weed and gay people. Libertarians like weed and gay people. Republicans like guns and money. Libertarians like guns and money. The problem that we have is the authoritarianism in these parties. And even libertarians don't like the Libertarian Party any more than they like the Republicans or the Democrats because of the it's not really a totalitarianism, but it's this authoritarianism and oligarchy part of it that really pisses libertarians off. So that's all. I've always defended gay rights, always been in favor of gay marriage, publicly and privately. It's all over my YouTube from 20 years ago forward. So we can get that out of the way currently. I'm not homophobic. I'm not transphobic. I just don't believe you can transition. I don't believe that you can change your sex, and neither does this person who tried it. So I just wanted to start with this.
I was a confused 12-year-old girl who found herself in online transgender forums and was introduced to the concept of gender identity, which became my autistic fixation. I was taught that my gender nonconformity and my discomfort with puberty and my same-sex attraction was not evidence that I may just grow up to be a lesbian, but that it actually meant that I was a straight boy trapped inside of my wrong female body. For half of my life, I believed, as do many others in this room, that without lifelong medical intervention to affirm this male gender identity, I was doomed to end my life. This was presented as a fact, rather than as a tenet of an unprovable belief system with no robust evidentiary underpinning. The male gender identity I was told was innate disappeared as I lived through the horrors of October 7th in Israel. I woke up to a siren and did not have enough time to run to the bomb shelter and to put on my gender-affirming breast binder. Being forced to prioritize survival over identity made me realize what a first-world absurdity it is to pretend that the concept of gender identity is somehow more real in nature than are the claims of any other unprovable belief systems. Unfortunately, the effects of my temporary belief in gender identity have left me permanently damaged. This belief system hijacked half of my life, derailed my psychosocial development, and disfigured my breasts, harmed my posture, hurt my ribcage, and has left me in pain while breathing. There is no solid evidence that gender identity exists in the brain, in the body, or in any objective way, because sex is not a feeling. It is an embodied reality. Enshrining gender identity in law forces all of society to abide by the religious-style belief that a man is a woman if he simply believes he is. Protecting gender identity in law necessarily erases all sex-based protections, from women and girls to have single-sex spaces and sports, for gays and lesbians to not face lawsuits for keeping their establishments single-sex, and the rights of all children to grow up without being chemically castrated for the crime of playing the wrong kind of make-believe dress-up as a toddler. Make no mistake, you may think that by enshrining gender identity protections into law, that you are protecting the most vulnerable among us. In reality, you are only protecting a dangerous belief system that only comes at the expense of the most vulnerable among us. Thank you. I cede my time to questioning.
Okay, and then I'm going to play something from Matt Walsh, who testified for HB 1 in Tennessee, which passed. This is to protect people against gender-affirming care. Mostly kids, in fact, mainly kids.
Well, the claim that doing the chemical castration drugs or surgery or hormonal intervention, the claim that this prevents suicide or has positive psychological effects down the line is utterly, totally baseless. There are no credible long-term studies that bear that out. And one of the reasons for that is that there couldn't possibly be any credible long-term studies because we've never done this to kids on this scale ever before in history. So this current, shall we say, crop of children, they are the guinea pigs. This is all experimental. We're sort of trying it out on them to see if it works. Now, they have attempted a few times to do studies, and the interesting thing is that the World Professional Association of Transgender Health, WPATH, which is a radical far-left pro-trans organization, they commissioned a study to try to prove that that hormones and puberty blockers decrease suicide rates among trans-identified youth. And even in their own study, they found that they couldn't prove it. They couldn't make that link because it's just not possible to do. The other thing I would mention too is that, the number of trans-identified youth has skyrocketed in recent years. We're talking about exponential 10x, 20x growth. Just huge numbers have increased. And what we hear from the pro-trans side is that, well, this is not a social contagion. It's just that, there's always been this many trans people. It's just that they were not in an affirming environment before in history, and so they couldn't come out. And now, for the first time, trans people have the ability to live their truth, so to speak. Well, if that's the case, And there have always been these sort of like millions of trans people. And if it's also true that if we don't affirm them, that it would cause them to commit suicide, then we should be able to look back in history and find just this unbroken, incredible epidemic of children mysteriously killing themselves because they weren't being affirmed as trans. And what you find is that that didn't exist. I mean, the youth suicide rate has increased exponentially alongside trans affirmation. So trans affirmation causes the suicide rate, not the other way around. The last thing I'll note is that the suicide rate among trans-identified people is sky high. It remains sky high. All the data shows this. It remains sky high even after surgery. And in fact, in the most reliable data that we have, it's years after surgery when suicidality is the highest for trans-identified people. That's the reality.
Chairman Fixation, you good? Okay. Any